Hello to all the future nurses. So I'm back here today with the most prominent topic coming in your nclex-rn exam. So it's ventilator alarms. So there are two kinds of ventilator alarms which we have. So first one is your high pressure alarm. Second is your low pressure alarm. First, we will be discussing your high pressure alarms. Okay. So from high, you have to consider the H of the high. So high means high blockage, right? So what are the causes of the high pressure alarms? So when the pressure in the circuit is increased, that leads to your high pressure alarms. So causes are client coughing, like if client is continuously coughing, so of course the pressure can be increased, like circuit can see, oh, what's happening, so right, so the pressure can get increased in your circuit. Then is gagging, that means client is choking, right? The third one is bronchospasm, like your airway is getting narrowed, your airway is getting tight or restricted due to some reason. That can also lead to high pressure alarms. Then fighting the ventilator, if patient is trying to fight the ventilator, means like he's not doing actually fight with the ventilator, like maybe he suddenly woke up, right? So now he's like, oh my god, where I am, right? So that's known as fighting the ventilator. The fifth one is your ETT occlusion, like your endotracheal tube is occluded, right? Narrowed somewhere. So that okay, so that means maybe somewhere your ETT is blocked, right? Or not. Then the another one is kink in tubing, like maybe there is a kink in the tubing which is causing increased pressure towards the ventilator, right? Then your secretions, like thick secretions, if the secretions are thick, like if they are increased, right? So that can also narrow your tube of the ventilator, and this can cause increased pressure or resistance in the ventilator. The last one is water in the circuit. So if there is a water in the circuit, so imagine what will happen. The water will dysfunction the ventilator, the pressure will be automatically increasing, right? So that means that it contributes to high pressure alarm, because most of the students get confused. If there is a water in the circuit, they just lead to the low pressure alarm, but no, it's just a high pressure alarm. So that was okay. So the other factors which I have not mentioned here is if the patient is biting the tube, right? So if the patient is biting the tube, it can lead to increased pressure. So of course, it can be listed under high pressure alarm. And the other cause can be your pneumothorax. So what actually the pneumothorax is, like it's an accumulation of atmospheric air in the pleural space, right, which results in the rise in intrathoracic pressure and reduced vital capacity, right? So these are some, leading causes of your high pressure alarms. You just don't have to, cram them or memorize them. Just think, critically, that how the pressure can be increased in your ventilator, right, which can increase the pressure in actual terms. Okay, so now we have the low pressure alarms. So from low, you have to remember L. L stands for your leak or loss of connection, right? So as simple as it is. So maybe there can be a leak somewhere, or the connection is lost, because that's why your ventilator is not putting, pressure, that enough or sufficient pressure, right? So what can be the etiology for that one? So first is tubing is disconnected. So of course that's like common sense. Like tube, if the tubing is disconnected, like there will be no pressure. Loose connections, leak, right? Extubation. What do you understand by extubation? That patient take out the ETT, right? Like patient just remove the ETT. Then cuffed ETT or trach is deflated. Like if your ETT is cuffed or your trach is cuffed, but it's now deflated, air is leaked out. So the next cause is poorly fitted CPAP BiPAP mask. So I will be making the content on what is CPAP and BiPAP. So you should be, acknowledged the general terms of CPAP and BiPAP functions as well. And the last cause is like if the patient stops spontaneous breathing. Spontaneous breathing in simple terms means natural breathing. The guys, so natural breathing means that how you naturally breathe, right? So that's your spontaneous breathing. Like patient initiates breath, right? And ventilator support with the preset pressure, whatever the pressure is being set on the ventilator, but the client is like breathing by himself with the support of the preset pressure. So that natural breathing is known as your spontaneous breathing, right? If the client stops, like if the resident stops the spontaneous breathing, then there can be also a low pressure alarm, right? So that was all about your low pressure alarm. So in terms of that, okay, so in terms of that, now we are starting about the nursing interventions, that what nurse's role will be in such situations. So guys, if there will be a question on such alarms in your nclex-rn, it is the responsibility, it is a key responsibility of an RN to ensure that what is the cause of this alarm, because it cannot be ignored, like because it's happening because of change of condition in client status. So right, maybe it can be, you know, normal or abnormal. So you have to identify the cause and then you have to take the action. There is nothing like that that ignore the situation or something, right? So what will be the nursing interventions? First will be assess the situation, like what can be the cause for that. Second is manage that cause, that whatever it is causing, like if there is a leakage, identify it, correct it, right? Like if there is a thick secretions, so you have to do suctioning, right? So identify the cause and then manage it. But if you are unable to do so after doing your duty, then you have to call the respiratory therapist. Okay, so these are the sequence wise options in such situations which you have to do, and focus on the question that like what question is asking, right? So first is assess, second is manage it, and third is if you cannot do anything, then call the respiratory therapist who can help you in such situation. So let's start with our practice question. So question says a nurse finds that high pressure alarm beeps for patient on ventilator. What nurse will do first in such situation? First is a keyword. Highlight it, right? Don't just jump into the solution. Just read every point. Option A says ignore the situation and do dressing of another patient. It's wrong. Just eliminate this option. We cannot ignore the situation. Nurse have to promptly respond to the situation, as like it just indicate that there is a change in client's condition. Option B, delegate to LPN to turn it off. Can you delegate this task? No, never, right? Because we have to find that what it, like why it's causing, right? So option C. So option B, A and B are eliminated. Now your work is easy. You have to find out from option C or D that what can be the answer. Then we have option C, call the respiratory therapist. Now, like 30 to 40 percentage of nurses pick this option because they just see that, like sometimes we read in some notes that you have to call respiratory therapist, right? But like what your role will be, right? You are caring for the patient. What is your role first, right? And the question is also asking that what nurse will first do in such situation. Option D, we can just keep aside the C option. Option D says assess the cause of the alarm. So first, of course, we have to do the assessment, right? Here, the strategy of your assessment planning and your, intervention evaluation, which we, the hierarchy model we study, that also implies, and your this theory, which I already explained you in three simple steps, right? So first is your assessment. So you know that it's important that we have to first assess, right? And then we have to manage that cause, and then we have to call respiratory therapist if you cannot do anything. Like if it's not in your hands, like you have tried everything from your side, right? So if the cause is like thick secretions, maybe you have to do suctioning. If there is a leakage, you have to assist with that. If there are loose connections, you have to take care of that, right? So the answer here is option D, that assess the cause of the alarm first, and then you have to manage if you find the cause, and if you cannot do, then you have to call the respiratory therapist. I hope this makes sense to you guys in simple terms. I tried, and I will be making next video on your modes of ventilator or CPAP BiPAP. So stay tuned, and thank you for watching.